Hello, welcome to session 9 of fetal growth and child development. In this session, we'll look at the normal newborn part 2. Session overview. The normal newborn should be examined within 24 hours of birth. Examination of the newborn is done to confirm normality, to identify congenital abnormalities, and to provide health care, education, and reassurance to parents. The purpose of this session is to discuss how to examine and care for the newborn. The outline will look at the immediate care of the newborn and examination of the newborn. This is the reading list. It's Nurs textbook for midwives. Let's start with the immediate care of the newborn. Immediate care of the newborn at birth. Care starts from the labor ward. What you do is that you clear the airway. You gently wipe mucus from the mouth when the head is born. Unless necessary, it is important to aspirate the oral pharynx before the nasopharynx. So it means that you actually aspirate the mouth before the nose. Cutting of the cord. Divide the cord in between two clamps 8 to 10 cm from the umbilicus. Then you apply a gauze over the cord before cutting. Some centers advocate delay until respiration are established, but this may predispose the child to neonatal jaundice. Identification. You need to identify the child using name bands. You can use a China bead. Necklace may also be used on the wrist or ankle. The band must have the name, the sex, especially with the sex. Those who are looking for male children may actually say that you have exchanged their child for a female child if the sex is not there. The date and the time of delivery may be also applied immediately the child is born. Then immediately you assess for APGAR score, and I'm sure you all know about APGAR score, and it is assessed at 1 minute of birth. Within that minute, the general condition of the baby is assessed, then is repeated at 5 minutes. What are the signs that are observed? You observe for heart rate, respiratory effort, the muscle tone, the reflex response to stimulus, and the color. A score of 0, 1, or 2 is awarded to each sign. The normal infant will have a score of between 7 and 10. Below 7, the child needs to be resuscitated. So this is the table of the APGAR score, and we have all the signs there. So all the score, for instance, if you score 1 for heart rate, respiratory 2, and the others 1 or 2, at the end of the day you add all the score. Let's move on to the examination of the newborn at birth. If possible, should be done by the parents when the baby is naked in a warm environment under good light. But in our part of the world, we can't actually leave it in the hands of the parents. So it's been done by the nurses. It's done in an orderly manner. You look at the face, the head, and the neck. You inspect the tongue, the gum, the palate. You use your finger to feel the palate for any cleft, or look for any tongue tie. You note the position, which is very, very important. The upper part of the pinna should be in line. The contours of the eye. Slow set ears are indication of mental retardation. Then you inspect the ears for patency. You palpate the vault, and for the head, you palpate the vault and determine the degree of molding. You also examine the fontanelles. You examine the neck for swelling, flexion, and rotation. When it comes to the chest and abdomen, you should note the space between the nipples. Wide spaces are associated with chromosomal abnormalities. You also observe respiration from the movement of the chest and the abdomen. Still on the chest, you have to observe for the shape of the abdomen, and usually is round. You inspect the base of the umbilical cord. You inspect the vessel in the cord. There must be 2 arteries and 1 vein. Cut cord 2 cm from the base, clamp or ligate. The genitalia and anus, you examine the genitalia for any abnormalities. Limbs and digits. You note movement of the limbs and count digits, examine for normal flexion. Some of the children have extra digits, so that's why you need to count the digits. And you also note movement of the limbs. Examination of the spine. With the baby lying in prone position, inspect and palpate the baby's back for swelling, dimples or hairy patches. For the hips, carry out otolani test to detect congenital dislocation of the hip. And how is it done? What you usually do is that you place the baby on a firm flat surface. Then you hold the legs with flexed knees in the palms. Femur is planted between the index and middle fingers and the thumb. Then both hips are examined. Baby's thighs are flexed onto the abdomen and rotated and abducted through an angle of 70 to 90 degrees towards the moving. This is what we do when we are examining the baby, the hip, using the otolani test. You don't usually apply force. If the hip is dislocated, a click will be felt as the head of the femur slips into the acetabulum. You can also use the balance test, which is similar to the otolani test, but in this case, 1 hip is used at a time. So that is the balance test and the otolani test. Measurements. We have talked about measurements when we're looking at growth and development. The head circumference takes around the occipital protuberance and the supraorbital ridges using a tape. So that is how you measure it. The length is usually taken from the crown to the heel, and the weight by weighing the child. Protection. The newborn needs to be protected and should also be safe. Baby is assessed before transfer to the ward. The nurse receiving the baby must ensure everything about the mother and baby are in order for safety. Each baby should have his own equipment. Staff with infections should not handle the baby. Hands must be washed before and after handling the baby to prevent infection. You have to clean and inspect cord to prevent infection. Bottles must be washed and cleaned and dried after every napkin change or diaper change, and baby can have bath after rest. Then prevention of asphyxia. Place baby at the side after feeding. Then suction machine must always be available. We also need to prevent hypothermia. The room temperature should always be around 18 to 21 degrees Celsius. Baby should be dressed in a cotton dress. Then warm bath can be given, not cold bath. Then we have to prevent them from getting injured or from having accidents. So precautions should be observed by staff and must be explained to parents. Baby should be moved from one place in the cot rather than in the arms. When you are transporting the baby from the labor ward to the ward, make sure that you put the baby in the cot rather than putting the baby in your arms. So on prevention of injury and accident, polythene bags should not be used near the baby. Safety pin, if possible, should be avoided. Then feeding. Observe baby's readiness, eagerness, or reluctance to feed. Then excretion. Observe phases of stool and vomiting. Then you observe the sleeping pattern and wake pattern, whether the baby is sleeping too much or is not having enough sleep. You should also note that. Then you have to document all your findings and report any abnormalities. The examination can be done by a pediatrician or a competent nurse. All newborn babies must be examined by a pediatrician, obstetrician, neonatal nurse practitioner, or a midwife within the first 24 hours. And this is how it's supposed to be done. The type of assessments, we have the system by system, we have neurological examination, we have auscultation, have palpation, and you can also do blood test. Daily examination and care every day until discharge. The baby is examined by a midwife to evaluate progress and identify problems as they arise. The first day it needs to be examined by a pediatrician or a competent nurse, but every day examination is similar to that at birth. We have been looking at examination of the baby, the newborn. We look at the immediate care given to the newborn as well. Thank you.